Again, if you have any questions, you can feel free to put those questions in the chat located in your systems tray. So on the MCCA website, you can locate all of our past, present, and our upcoming events. And this includes today's event, the MIBridges Webinar. It's here where you will be able to find the recording of today's webinar for later viewing. And we have some upcoming events on our calendar as well that we want to make sure that you all are aware of. And that consists of the CARES Act Town Hall, which is going to take place on Wednesday, May 6th from 9 a.m. to 10:30 a.m. So go ahead and mark your calendars now. It is during this webinar that we will be joined by Rob Johnstone and Priya Shaplot from the National Center for Inquiry and Improvement. And they are going to be talking about how colleges are managing the CARES Act funds distribution to students. Registration for this webinar is required, and it's going to be engaging and interactive. And so Rob and Priya will share information regarding the CARES Act and provide colleges opportunities to share some of their successes and challenges some of you might be experiencing during this time. If you have questions about that webinar, you can feel free to reach out to Erica. The next upcoming event is the Trellis Research Webinar. And both of these webinars, again, are going to be delivered via Zoom. So the Town Hall will be via Zoom as well as the Trellis Research Webinar. The Trellis Research Webinar is scheduled for Wednesday, May 27th from 1 to 2 p.m. And this webinar is going to be an introduction to the Trellis organization, the Trellis Student Financial Wellness Survey, how the data from the survey can be used to impact your campus culture, as well as the survey administration timeline. Registration for this webinar is open and can be found on our website as well. Our final announcement is regarding some resources that may be of interest to you or your students. On our resources page on the MCCA website, you can locate information pertaining to unemployment alongside other resources related to COVID-19. Again, with respect to our neighbors, everyone has been muted, but if you have a question, you can put your question within the chat and I will monitor that throughout the presentation. And with that, I will turn it over to Jess Spreet with Michigan Department of Health and Human Services.
All right, thank you. Speaking of the world of Zoom, I am going to call out that my dog is passed out behind me. So if you suddenly start hearing snoring, I apologize for that. So we're going to go into kind of a brief overview of MIBridges and some of the features that we have in the portal for both clients and our community partners. And then we're going to talk about some of your community partner roles, trainings, and then resources available to you all as you're doing this work. And then I'm going to open up to questions to see if there are any questions that arose through my presentation that you just really want answered. There is also, I've added a section here about some of the COVID-19 response that we have here at MDHS, so I'm going to go over some of that as well. So just to talk about, before we get into MIBridges, we have this initiative called the Integrated Service Delivery, or ISD, and MIBridges kind of falls underneath this initiative. And part of that work is to be a little bit more holistic when we're providing services to clients instead of being siloed. So there's an overall vision for this, and that vision was to improve our systems to improve the lives of Michigan families. So we wanted to kind of transform how we approach that. So with that, there are 3 strategic objectives. One was to deliver services in ways that recognize and support the unique needs of our clients. So we all know that isn't usually just one need. There's quite a few different needs affecting them, and they all interact with each other to really give what is happening to that client a little bit more unique feel for the individual. So we wanted to transform the way we provide our services to be a little bit more holistic. The other was we wanted to work with partners a bit more to support and aid people in achieving that self-sufficiency and independence. We've always had partnerships, but as we rolled out this new MIBridges in 2018, we were really looking at strengthening that partnership because we're all working together and we're trying to achieve similar goals. So we wanted to make sure our partnerships are stronger to really address those needs holistically with the client and increase that collaboration. And finally, the third strategic objective was to educate and encourage individuals and communities to support healthy behaviors and lifestyles. So MIBridges is really designed with these objectives in mind. So just to kind of give you a brief high-level overview before we actually get into the features of MIBridges, there are 4 things that we've improved with the system. So one was we made common processes easier for residents, as well as providing more self-service features so that they can manage their benefits better and keep the benefits and complete renewals and report changes. The other was we wanted to support community partners a bit more and help them play more of a significant role in helping residents within the MIBridges portal, because we know our partners aren't just really helping with application assistance, but connecting them to other social supports and providing those linkages so that all of their needs are met. And we've incorporated some specialized features targeted specifically at community partners and the work that they do with clients. And finally, with the whole holistic approach in mind, we wanted the portal not just to be an application-based system. So we partnered with Michigan 211, and we're pulling in resources from their database so that anyone in the state of Michigan can search for resources and not just apply for benefits. So MIBridges is no longer just for beneficiaries or folks who are trying to get benefits from the state. Anyone in Michigan can use it. In addition to that partnership with 211, we've also integrated with the Great Start to Quality database, so folks can now search for licensed childcare providers within MIBridges as well. So with this change in MIBridges, we have now three community partner types. 2 of these we've always had, so I'm gonna go over those first. First, I'm going to talk about the access partner. So those are organizations that agree to provide mobile devices, laptop computers, and internet for folks to get on and use MIBridges. So basically, if someone walks into that organization, they can use those devices to get on MIBridges and use it on their own. So typically, we have organizations with a bank of computers that become access partners, so like libraries, computer resource centers, Michigan Works, organizations like that. Currently, during COVID-19, a lot of our access partners are currently not available for providing that service, but once we return to normalcy, they are going to be a resource for folks to go in and use their devices. The other partner, the type that we have always had, is a navigation partner, and I believe most of you are going to be MIBridges navigation partners if you are not already. So this is our most involved partner type, and those are organizations that agree to provide one-on-one assistance within MIBridges, and that assistance can vary from anything by simply answering questions about the portal, helping them complete an application for benefits, or searching for resources. So that kind of what navigation looks like varies by organization, but that is our most involved partner level. The new partner level that we have, because it's not so new, it's been 2 years, but this is in part because of our partnership with Michigan 211, and that is our referral partner. So these are organizations that agree to receive electronic referrals directly from clients in MIBridges. And these are organizations that provide some sort of community service in their area. So a food bank can be a referral partner, a employment assistance agency can be a referral partner. So those are the organizations that do that. And essentially that means, say if Precious is looking for resources related to food and she found one and wanted to save that to her dashboard, and that food resource is a referral partner, MIBridges will prompt to ask them if they want to send her contact information to that organization directly. So the burden of contact is now on the organization. This is one of my favorite features of the new MIBridges, just because I used to work on the ground and provide that one-on-one assistance. And I can't tell you how many times I've had someone tell me that they ran out of minutes on their phone, or they've lost the contact sheet that I provided them, or spilled their coffee on it, and we've had to search for that information again. So giving that burden to the organization really alleviates some of that for the client. So I'm going to go quickly over to some of the features. I'm going to talk high level, just because we only have an hour, so I can't talk about a lot that's available within MIBridges. But the first thing I really want to talk about is the newest feature, is that's the resources. We have something called Help Me Find Resources, and it's a guided assessment that helps MIBridges identify underlying needs for the client in a more proactive way, and provide a list of resources that are tailored to those needs. So we recommend that clients do this first instead of jumping into the benefits application, because once they go through the survey, MIBridges will pull both state resources and community resources. So if they indicate something that mean that they'd be eligible, that might mean they're eligible for benefits with the state, MIBridges will display that as a resource. But we do understand some clients just want to go into the application because that's what MIBridges is known for. But we do strongly recommend this happens first, because it's something that they can choose multiple topics for. So we have about 10 topics here. You can kind of see it here on the screen, but there are like food topics for food, healthcare, income and employment, childcare, legal services, and housing. So folks can choose as many as they want as they go through this. We typically recommend 2 to 3, just because we don't want clients to be overwhelmed by the amount of resources that may be displayed afterwards. And MIBridges really only needs about 2 to 3 questions for each topic to be answered in order to identify what resources might meet their needs. So once they go through this, they'll be brought to this screen where there's the list of resources available to them. And they're categorized by the topic that they chose. And then the information displayed here, if it's a community resource, is pulled directly from 211. So you'll see the service description, any eligibility requirements for it, fees that might be attached, any application process. They'll have the contact information, and even the location and how many miles away it is from their address. So this is all pulled from 211. There is a way to report inaccuracies directly to 211. So if you're working with a client and you notice some of this information is incorrect, you can't see it on the screen, but on the right-hand side, if you scroll down more, there's going to be a link to report inaccuracies, so that 211 is made aware and they can work to rectify that. So if they go in and save resources, and they save a referral partner, so if you see that purple tag in the back, it says, it actually reads MIBridges partner. I don't know if you can read that. And that indicates that that organization is a referral partner. And if they select that organization and save, this is the pop-up that displays, letting them know that they can send their contact information if they want the organization to contact them to provide services. They certainly don't have to share their information if they don't want to, but it is an option here available. And this is the way referral partners receive those referrals by clients in MIBridges. So I talked about how navigation, we've put in like specialized features for partners, and this includes our navigation partners. Clients can be connected in MIBridges to up to 10 navigators, and they can share key information with those navigators. So they can share their benefit information, including letters. They can share their household information, so other folks who are receiving benefits or they've included in their household. And they can also give them permission to talk to the caseworker at a high level about their case. Now, navigators can't make changes to the case, but they can talk to the caseworker about it. The client has questions, and the navigator is serving as the advocate to help the client better understand their benefits. So this is kind of how they do it. A navigator gets their own community partner ID number or CPID. So once they go through training and we link those trainings and they get their account in MIBridges, they get this number, and that's how that connection happens. But once they connect, they can provide that consent. Something to note here, these consents are active for about a year and they need to be renewed. And a client can remove that consent at any time if they want to. Now, this is what MIBridges is typically known for, and that's applying for benefits. We've simplified the application quite a bit, and this is modeled after the paper application. So the same color scheme, icons are used on both. So folks that are going back and forth between the two, there's consistency, so they're not surprised at what they see. Before 2018, the application online took about 45 to 60 minutes to complete. On average now, it's about 20 minutes. And we've had community partners tell us that, for example, they can do a healthcare application under 7 minutes. So it's really simplified the application, makes it a lot faster, giving folks time back in their day, and just reducing overall stress is what we found, and a lot of folks have liked this change in our application. Once they've applied, we have this kind of dynamic confirmation page. So all applications will have a tracking number. So if they have questions, they can always call their local office and provide the tracking number to see where they are. Healthcare, it's a real-time determination. So they'll say approved, pending, or denied. Sometimes with approved, we do like folks to just kind of wait, because sometimes caseworkers will review the application and then reach back out to the client if they have further questions. But this status on this application only happens for healthcare applications. The dynamic part of this, in addition to the status for the healthcare, is the send referral section. MIBridges will proactively suggest referrals to send based on the application and the information provided. So if a client answered a question in MIBridges indicating that they're pregnant or were pregnant the past 3 months, they will get this suggestion to send a referral to WIC services or the local WIC office right here on this confirmation page, and they can click send and their information will go to the WIC office automatically. The other one is if they're completing a SER or State of Emergency Relief application, MIBridges will suggest that they send a referral to a MEAP grantee or Michigan Energy Assistance Program. It'll be labeled as energy self-sufficiency, and they can send it this way too. Finally, on this page, we have this benefits to-do list. So this is like the next steps folks can do for their application. Based on the information on their application, MIBridges will suggest documents that they can send. And in addition to that, if a caseworker sets a verification request, because they need more information, so they need documentation on a child care provider or unemployment, MIBridges will list those here. In this scenario on the screen, this person received a verification request but didn't submit it on time. So they'll see date due, overdue, letting them know that immediate action needs to be taken and where they are in their case. So this information is dynamic, and it'll provide description of the type of document that's being requested or suggested by MIBridges, who that is for, and the date that it's due, and they can simply upload it here if they're on their desktop, if it's on their desktop already. We've also, I talked about some of the self-service features that are available. We have a mobile device emphasis, and I'll go over what that looks like later on, because we made MIBridges mobile friendly. but here is the desktop view where they can see key information about their benefits. So in that back image, you'll see this person has 2 benefits, healthcare coverage and SER, state emergency relief. And they can click on that tile and they'll see key information like a renewal date, their beneficiary ID. If they are receiving food assistance, they'll see how much food is on their card, and cash assistance, how much amount that they have on their bridge card. Healthcare coverage, they'll see information like who is their primary care provider, their health plan. So key information so that they can manage their benefits better and understand kind of what the benefits that they're receiving. They also will have a list of letters that have been sent by DHS. So anytime a letter is sent to a client, and if they have a MIBridges account linked to their benefits, those letters are uploaded into their account and they will be able to see those letters for up to 12 months in the system. For those who have MIBridges, they get their letters a lot faster because they're uploaded in the system the day they're mailed out. Because we know sometimes addresses might be inaccurate, things get lost in the mail, they put down a mailing address and forgot to change it. So having the ability to locate those letters online has made it a lot easier for folks because they can get that faster and they have access to it. So this is the report changes page. So it's, it has an easy to understand topic selection like you saw with the Help Me Find Resources survey I showed in the beginning. And there's helpful text under each under each topic to provide additional guidance. So if folks have questions on what type of change that they can report under each of these topics, we've made this a lot easier. So example for the address, they can report an address change here. It's actually, I need an updated screenshot for this. There's actually a new tile here that says, have you moved or did you move or something along those lines, and that makes it a little bit easier for folks to know that's where they can do their address change. So I guess I can talk about how MIBridges is dynamic and we make changes based on feedback. So one of the things that we've heard is that it was unclear where they can make that change for their case so that they can get those documents mailed to the correct address. So that's something that we've changed in MIBridges to make it easier for folks to report changes that are needed for their case. So I talked about how MIBridges is mobile friendly. It was actually developed to be mobile friendly before it was developed to be desktop friendly. So you can see the same type of information on a mobile device, as you can see if you go into MIBridges on a computer. There is no app for MIBridges because it would take up way too much space. So folks may have limited data on their phone, so we didn't want to take up limited storage on their phone, and we didn't want to take up all the storage on their phone with MIBridges. So the website's been optimized to be mobile friendly. So if they go to the website, it'll automatically show the mobile version. One thing that I actually really love about MIBridges is that now when they want to submit documents, they can simply take a picture from their phone and upload it that way. I know a lot of folks don't have fax machines, scanners. I know I barely have a stamp, so it's hard to mail things in. And it's also hard to arrange transportation to go into office and drop off those documents, so they can simply take a picture with their mobile device and submit it that way. And if I remember correctly, I think about 60% of documents submitted are submitted via photo from a mobile device. So that's quite remarkable, and we've done that on purpose because we know a lot of people have smartphones but don't have computers. Another thing that's changed is that folks can sign up for notifications. So for example, they can sign up for a notification whenever a letter is sent. So if a letter is sent, they get notified and they can log into MIBridges and see that. So there's key information that they can sign up notifications for. So the next thing I'm going to talk about is the functionality that's available for community partners. So the first thing, we're going to talk about some of the benefits of becoming community partners. As I said, each partner will get a ID number. Each individual at a organization will get an ID number called Community Partner ID number, or the CPID number. And that's required to do that connection for navigation, for navigators to get the consent to see benefit information, household information, and talk to caseworkers. You'll also receive ongoing communications from us regarding MIBridges changes and policy updates. And each partner will eventually get a starter kit of promotional materials. Right now during COVID-19, we do not have access to those materials to send those out when you sign up, but we are keeping a running list. So when we get back to the office, we will be sending that out to everybody, but they are available online, and I'll show. I have a website that actually the website's right there. If you go to that website, you can see those online documents. So this is the customized dashboard for our community partners. So once you've got your account set up, you'll have this view. This particular partner is both a referral and a navigator. And the community partner ID number that I talked about is right there next to the name. So you don't have to ever remember that number. They are getting pretty long. We have about 3,500 community partner users in MIBridges helping folks. So those numbers are getting long. You don't have to remember them because it's right there on your dashboard every time you log in. For navigators, there is a client directory available. So any client that you're connected to see that information will be listed here. There is quick access to see that key information. So you have to see those 4 or 5 tabs there. You have household information, needs and resources, benefits, appointments, and docs needed. So you'll be able to see, if you have consent for all of this, you'll be able to see any resources that they've saved to their account. You'll see the benefits they're receiving, the benefit information and letters for those clients. One caveat here though, because of HIPAA compliance, for healthcare coverage, you're not going to be able to see the primary care physician or the health plan or any of that key health information. You'll see appointments. So if they have any appointments coming up, you'll see when those dates are. If you'll see past appointments and missed appointments. You'll even see docs needed and the date they're due. So here is a view of our referral partners. So when they see those referrals come in, they'll see the date of the referral, the name of the client, and the referral reason. So this is a quick view for them to kind of identify who can manage that referral and provide those services. Once they provide services and they close the referral out, they could provide feedback on that referral. So they indicate if they provided services, if they couldn't provide those services, if they forward the client to another account, they could even suggest other resources to the client to meet that need if they are unable to provide service. This helps 2 ways. One is MIBridges keeps tracks and metrics for each organization that they can pull on their own. So if you're a referral partner, you can keep track to see when you met needs and when you did it and why. It also helps with when you go look at the resources. So a navigator referral partner can see resources if they're given consent. And when you look at them, you can see the status of the referral. So you can see how clients are interacting with other organizations. So this helps reduce duplicity in services. Also, it can help increase collaboration with other organizations in your community. So the next thing I'm going to talk about is community partner registration and some training. So community partner registration is always open in MIBridges. You simply have to go to michigan.gov MIBridges/MIBridges and click on the community partner tab and start the registration process. Before going into that, if you're not a partner, I do recommend that you go to our community partner webpage, and that's michigan.gov/MIBridges partners, because this website is dedicated to our community partners and how they can effectively use MIBridges and register. So there's a lot of tools and resources to prepare for the registration process. It goes over some of the requirements for community partners. It also has how-to videos and job aids and some of the functionality in MIBridges. So I do encourage you to go there before you register so that you can familiarize yourself with the process, as well as familiarize yourself with some of the things that are available in MIBridges.
Excuse me, Jaspreet, there was
Yeah.
a question that came through the comments.
Mm-hmm.
If community colleges become a referral partner, does that mean that a MIBridges user could, quote unquote, send their information to the community college and the community college would contact the person?
Yes. So that is a referral partner in a nutshell, but because I didn't go over this, you have to be in 211 first before you can become a referral partner, because we're pulling the information from 211 so we can show the services provided by partners. So the only way we can send those referrals if you are in 211, so we know what services you provide.
Mm-hmm.
But yes, if say you have a food pantry at your community college that you want to advertise, and I go through MIBridges, I save you as a resource for food, I can send my contact information if you become a referral partner. That is correct.
And if you are a navigation partner, it sounds like you could see what resources your students are accessing in state level programs and the referral partners they have contacted and interacted with. Is that correct?
Yes.
Okay. Great, thank you.
Mm-hmm. And as a referral partner, any referral you receive, you'll be able to see resources saved and how they're interacting with those resources as well. Okay. So the training requirements for our partners, we have 3 separate trainings. One is for a navigation partner. It generally is a 4-hour classroom training, but I will talk about our COVID-19 version of that training and then the next couple of slides. But this training is required for our navigation partners, and we go over all of what I just talked about in much more detail. So we talk about how you can create an account, find those resources, apply for benefits, view that case information, and how you can use navigation features like the client directory. The referral partner is a 1-hour web-based training that is required for all of our referral partners. And that's, again, in much more detail on the referral functionality in MIBridges. Access partners, that training is not required. It's only suggested, and it's a 30-minute web-based training, just so that they have an idea what's available in MIBridges, so they can answer basic questions if someone asks them questions if they go into their office to use their device. So the final thing I want to talk about is MIBridges and our COVID-19 response. So the first thing is the MIBridges navigation training is temporarily online. We have condensed that to an hour and a half. So some things are going to be cut out of it, unfortunately, so we can do this online training. We have one scheduled for May 14th coming up. We hope to resume our in-person training starting in June, but that all depends on our situation because we know it's fluid. We've also issued a phone assistance guidance for our navigation partners because with the stay-at-home order, we are limiting contact with other people. So a lot of our community partners are no longer providing the in-person assistance unless it's absolutely necessary or by appointment. And most of them want to try to do this phone assistance. So we've provided this guidance that's effective through April 30th and addresses 2 separate scenarios. One is with clients who have access to devices and internet but are not as comfortable with technology. So I'm just going to do a real high level. What that means is navigation partners can create the account for a client when the client is on the phone. But once the account is created, the partner has to give the username and password to the client and have them log in and complete the application and navigate through MIBridges as the navigator is talking them through how they can do that. The other one is clients who do not have access, devices, or internet. So that's a little bit more involved, but at a high level, that's creating the account and filling out the application and submitting for the client. But there are consent requirements around this because, as I said before, navigators cannot take action on a client's case because you're not the client or the authorized representative for the client. So you have to get consent, whatever possible, prior to doing that submission, written consent prior, and retain that. But there is some leeway that you can get that consent afterwards. But it should always, whenever possible, be happened prior. And we send out the details of this guidance to all of our newly trained navigation partners, but it is only in effect April 30th, so it may not be relevant to you folks, but hopefully we do get back to normal sometime in May, but if it is extended, we will let you all know if that guidance is extended.
Jaspreet, I have a couple more questions that came through the chat.
Yep.
Along the lines of online training, would you guys consider online navigation training through summer and fall if colleges are not allowed or support employee travel?
Yeah, so the situation is fluid and we're watching it. It's all related on some of the policy changes that are happening. So right now it's only affected to April 30th, but we will reevaluate in May and June.
Okay, and then the next question is regarding a TRIO program at some community colleges, and a TRIO program provides services for first generation and low income adults and students in the local community. Can TRIO become an agency to receive referrals for post-secondary education?
So if I'm understanding this correctly, that program is part of the community college, correct?
Yes. Yep.
Yeah, so you can list that as a location. Because when you register as become a partner, you could have multiple locations.
Okay.
Yep. And those.
So then they TRIO itself can receive referrals.
Yes. Okay. And as long as they're in 211. And just kind of clarify a little bit with those multiple locations, not all locations for a community partner have to have the same partner levels. So let's say I register as a partner and I have 5 locations. I could have 2 locations be navigation only and 1 location be a referral only, and then another location to be all 3. So it's very flexible and what makes sense for you as an organization.
Okay, great, thank you.
Okay, so the next thing related to MIBridges specifically is that we have received some guidance on the application submission within the portal. They are looking for additional information for faster processing during this time, so that if it's applicable. So in the comment box at the end of the application, so there's always a comment box that has about 12,000 character limit to it. They want this information included, if they've been laid off and what date they've been laid off, when they received their last paycheck, and the estimated amount of that paycheck, or when they expect their last paycheck and the amount of that. Where do they work? So their employer name, job title, last day of work, and the phone number for their employer, and if their hours have been reduced, and what date those hours were reduced, and if this is applicable for the application, for housing expenses, to provide the rent amount, landlord name, and phone number. So this is just to help with faster processing, because we know resources are pretty strapped during this period. So we want to get these done as quickly as possible to get folks their benefits. So now I'm just going to talk about, at a real high level, about some of the temporary policy changes. I can only talk at a high level. So if you all have specific questions on the actual eligibility and program implementation of these policy changes, I unfortunately won't be able to answer those. But I did provide some links here. So I do encourage you to click on those links to read more about what those changes are. So the first temporary policy change is related to food assistance. So Michigan was the first state to receive what's called the Pandemic Electronic Benefit Transfer Program, or PEBT. So this is an assistance program that will go to Michigan families with students ages 5 to 18 who are enrolled in the Michigan Department of Education program for students eligible for free or reduced price school meals. And this includes families currently receiving food assistance benefits, as well as those not currently enrolled in the program. So this is for families essentially who now have to provide food for their children who may have been fed previously when attending school. So it's a little additional financial burden during this time, and it's really intended to help alleviate some of that. The other temporary change is related to the Double Up food bucks. So in response to COVID-19, their Fair Food Networks program has made a temporary change to earnings. It has temporarily removed the $20 daily limit that a customer can earn on fresh foods and vegetables. So many of their participating grocery stores, and I believe all of their farmers markets and farm stands currently have openly removed these limits. So folks no longer have to have additional food bucks for their groceries. This is a temporary change. I do want to stress that. And the Fair Food Network will indicate when changes to the programs have been made. They do, I think, update this website that I have on this slide. And I know that Precious is going to be sending this deck to you if she has not already. So you'll have that link. So I do encourage you to review the information on there and check back to see if any changes have been made. Another change to food assistance is related to the food assistance program with the department. So as a response to this outbreak, they have been temporarily removed the federal work requirements for folks receiving food assistance. They've also decided to max out the monthly allowance for group sizes based on the allowance available for that group size. So this change only applies to customers not already receiving that max benefit amount, but they are maxing that out for folks who are receiving the food assistance. So those are the two main changes that are happening to the food assistance program. The other change is related to Medicaid. So in response to the emergency health declaration, they are suspending program coverage closures for all Medicaid programs, and that began on March 18th and will be in effect through the end of April or until the first month following the termination of that declaration. So whichever is later. Medicaid will still be closed if an individual moves out of the state or requests that their benefits be closed. It's just for other scenarios, it will temporarily suspend those closures so that folks will still have their access to healthcare. The other one that I want to talk about here is the change to SER, or State of Emergency Relief. They made several updates to their policy. And one of them is that they are no longer requiring a phone interview for folks who are receiving SER, unless it's required and things that have to be resolved. They are suspending the one-time energy assist, so they're no longer limiting the one payment for the remainder of the fiscal year, but the service caps will remain the same. And they are increasing the non-cash asset limit to $15,000 to align with the cash asset limit to align with other asset limits for other programs. So this is for all of their SER services. with the exception to burial services when the deceased is the only group member. In groups, SER in groups who are composed, who receive FIP benefits, so that's the Family Independence Program, state disability assistance, the supplemental security income, Medicaid programs, or food assistance, they will still continue to have automatic eligibility on the basis of non-cash assets as well. So those are some of the key things that are happening with temporary policy changes that MDHS has pushed out. And we provided these updates to all of our current MDHS partners. So I wanted to share this with you all, just in case you weren't part of that mailing. So to quickly, we're nearing the end, so I'm just going to go over some of the resources here. MIBridges has a dedicated help desk. So any client or community partner is experiencing technical issues with MIBridges, they can call this help desk Monday through Friday, 8 a.m. to 5 p.m. So examples are if they receive an error message or if they need help with account recovery and the online links aren't helping with them. I do want to note that the help desk gets about 40,000 calls a month. So we want to stress that they can't help with benefit-specific questions. So those should be directed to the local office. So if they have questions regarding their case, they shouldn't call MIBridges. They should call their caseworker about it. And to go with that, I mean, this is a little bit small. There is a link to the contact information for MDHS offices located on the FAQ page of MIBridges. So if they don't know what the contact is, they can always navigate to this page and get that information. Speaking of the FAQ page, there is a lot of information related to the functionality in MIBridges. So if you have questions about specific things, I do encourage you to go here and review some of those resources, because it includes answers to those common questions that folks have, both clients and community partners. Here on this page, you can also find a directory of our navigation and access partners. So if, say, someone calls you and you have like a full caseload and you are unable to assist, you can always navigate to this page to look for another navigator in your area that may be able to help, and you can contact to try to get them connected with the client. I talked about the MIBridges Community Partner webpage, but this is kind of what it looks like, partially what it looks like when you log into it or when you visit it. And you'll see like 5 sections. So we have features, and that's the features of MIBridges. So if you have questions about what some of those features are, because I did throw a lot of information at you today, you go there to see what that is. We have an FAQ page geared specifically towards community partners, so I encourage you to visit that as well. We have a Become a Partner section, so that's the section where we prepare partners for the registration process and the information that they need for that, and some of the requirements partners have to fulfill if they do become a MIBridges partners. And then the Tools and Resources section, so that is where all of our job aids, our how-to videos, even our bulletin that we send out to community partners on the changes that happen in MIBridges are listed there. So if you're curious of the history of MIBridges and how it looked at the beginning and some of the changes that have happened till date, I encourage you to go there too, because we put all of our bulletins there. So you'll see all the screenshots of what MIBridges looked like in the past and what it currently looks like. And then we have our community partner training section. So that is where you can visit to find information about our training schedule, how you can register for training. We do have the link to our main webinar on there. So if you go there, you can register today. And then I talked about the MIBridges Community Bulletin a little bit, but that is our monthly. Right now is every other month because we're focusing on other COVID-19 responses. But this is how we inform community partners on the latest MIBridges developments. So whenever we make significant changes to MIBridges, we do let you all know before they're implemented in there, so you're not surprised.
Jaspreet, I have a couple more questions that came through. Is there a cost associated with becoming a partner?
Nope. There is no cost to becoming a partner. There's one requirement that you can't charge a fee to provide MIBridges assistance to clients, though.
Okay. And then the second question is, there was someone who attended a MIBridges event last year and was told that education was one of the most frequently searched resources. Is that still popular?
In MIBridges?
Yes.
So actually one of it's utility assistance that's the most searched and saved resource currently.
Okay. Well, is that prior to the pandemic?
Yes, and current, yeah, it's both prior and now.
Okay.
Utilities.
Okay, great, thank you.
So if, after today, you thought about some of the information I provided and you have additional questions that we didn't get to, you can always send an email to mdhscommunitypartners@michigan.gov. That phone number goes to my desk. I am currently not in the office, so that email is the best way to get in contact with me. I do have 2 other folks who monitor that inbox, so you'll get an answer pretty quickly if you do send a question there. And then again, I do stress that partner website is a valuable resource to you all if there's questions that you have regarding MIBridges. All right, I'm going to open it up to any other questions in case there are some that come in if you're thinking about it.
Any other burning questions? I'm not seeing any additional questions pop up in the chat, but Jaspreet, thank you for this opportunity to learn more about the levels of engagement and sharing your email with us so that folks who have questions, they can contact you. I will be sending out the slide deck for the presentation today as well. And project leads, you can anticipate another email from me next Monday with the recording and an additional copy of the slide deck. And again, those upcoming events, I just want to do a reminder is that the CARES Act Town Hall is Wednesday, May 6th from 9 to 10:30 a.m. And then the Trellis Research Webinar is on Wednesday, May 27th from 1 to 2 p.m. You can find both of those events and register for those today if you'd like. It was great to virtually meet everyone. It was a pleasure to be able to facilitate this, and I am wishing you all health and happiness in the coming days. If you have any questions, feel free to reach out to us. And with that, have a great rest of your day. Thank you, Jaspreet. Bye-bye, everyone.